This medication is used to treat excessive sweating from your underarms. The drug solution is on a pre-moistened cloth for application to the skin. It works on the sweat glands to reduce sweating. Glycopyrronium belongs to a class of drugs known as anticholinergics. It is typically used once daily, and the best time to use it is in the evening before bedtime. Before using this product, make sure to read the patient information leaflet from your pharmacist. Qbrexza Towelette is usually used once daily on clean, dry underarm skin. It's important to not apply to broken skin. After carefully opening the pouch, unfold the cloth and wipe it once across one underarm, then use the same cloth to wipe the other underarm. Do not cover the treated area with a plastic dressing and do not reuse the cloth. Dispose of the used cloth in the trash and wash your hands immediately after use to avoid getting the medication in your eyes or other areas. Using this product regularly is key to getting the most benefit from it, so try to use it at the same time each day. And remember to tell your doctor if your condition doesn't improve or gets worse. Some common side effects of using Qbrexza Towelette include redness, burning, stinging, itching at the application site, dry mouth, nose, throat, skin, headache, and blurred vision. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to note that the benefits of using this medication outweigh the risk of potential side effects, according to your doctor's judgment. Many people using this medication do not experience serious side effects. However, if you experience trouble urinating or any serious allergic reactions such as rash, swelling, severe dizziness, or trouble breathing, seek medical attention immediately. It's crucial to remember that this is not a complete list of possible side effects. If you notice any other effects not listed, consult your doctor or pharmacist. And if you have any concerns about the side effects, don't hesitate to discuss them with your healthcare provider. Before using Qbrexza Towelette, make sure to inform your doctor or pharmacist if you are allergic to glycopyrronium or if you have any other allergies. It's important to discuss any inactive ingredients that may cause allergic reactions or other problems. Also, let your doctor or pharmacist know about your medical history, especially if you have glaucoma, myasthenia gravis, Sjogren's syndrome, stomach or intestinal problems, trouble urinating, or kidney problems. Keep in mind that this medication may cause temporary blurred vision, so avoid driving or using machinery until you can do so safely. Qbrexza Towelette may also reduce sweating in areas other than your underarms, which can make you more prone to heatstroke in hot weather. If you notice a lack of sweating in these conditions, stop using the product and seek medical help if you experience a fever that does not go away, mental/mood changes, fast/weak heartbeat, or dizziness. If you are planning to have surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this product. When using Qbrexza Towelette, it's important to be aware of potential drug interactions, as they can affect how the medication works and increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Qbrexza Towelette. If someone has taken too much of Qbrexza Towelette and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911. Otherwise, contacting a poison control center is also crucial. In the U.S., residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center for assistance. This medication is for use on the skin only. Do not apply to the eyes, mouth, nose, or genital area. If you forget to use a dose of Qbrexza Towelette, use it as soon as you remember. If it's almost time for your next dose, just skip the missed one and continue with your regular schedule. Don't use extra doses to make up for the missed one. Make sure to store Qbrexza Towelette at room temperature, and away from any heat or open flame, as it is flammable. Keep it out of reach of children and pets. Do not flush the towelettes down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. It's always a good idea to consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.